Hey everyone! Mamas, if you have diastasis recti or if you are worried about getting it, this chat is for you. Today I'm going to talk to you about what it is, what can happen when you have it, and stay to the end where I talk about some different treatments that can be used to alleviate the issue. So let's start off by introducing myself. I'm Devin. I am the admin for the group. I created Mommy Yoga. I've been a yoga teacher for 15 years. I'm a wife and I'm a mama. I have a 4-year-old daughter and a 1-year-old son. And I love helping women feel better in their bodies, and because I'm in this mama era, I am trying to help moms feel better too, because we have a lot on our plates. So I will start off by saying that I, fortunately enough, did not suffer from diastasis with my pregnancies, but I know that it is a super common thing that happens for us ladies, and I have done a lot of learning and research and training about it so that I can help people who are experiencing this issue and to dispel some I don't want to say rumors, like misconceptions about the issue. So I don't know about you, but because I'm a mom and because I'm interested in mom things, when I am scrolling, I see so many ads for people promising to fix the issue, or like reels or shorts where people are like, oh, I fixed my diastasis in 2 weeks by doing these 4 movements 10 times a day, every day. And I personally hate those things because I, first of all, don't believe it's true. I feel like they are trying to capitalize off of this issue that affects so many people, because like when it affects you, you're either feeling like uncomfortable and you don't want to feel that way, or you're feeling really like vulnerable because you already aren't feeling maybe the most comfortable in your body, and then there's this thing that comes up while you're scrolling that's like feeding on that discomfort that you have, and is making you a promise, and you're thinking like, because you're in this state, you're like, okay, I'm going to do this thing because this person's promising it. And I would highly caution against that, because it's an issue that if you work on it in a way some of these people are saying without any advice from your medical care team, you could potentially make it worse or give yourself even worse issues. So don't listen to those things is basically what I'm saying. Unless you really trust the person, or you've been following the person for a long time and you trust their advice, or maybe you are going to physical therapy and they have suggested somebody to look them up. In those cases, I would say sure. But if you're just scrolling and you see these things, because I see them pop up all the time, please just don't listen to them. And I'm not saying don't listen to them and listen to me, because I'm not giving you an exercise that is promising to fix it. I'm going to be educating you on the issue, and these people are like, do this exercise 4 times a day and in 2 weeks you'll be healed. It's lies. Like, it's, even even if in the off chance that did happen for them, which it didn't, like, I'm gonna be honest with you, it did not happen. But even if in the off chance it did, it doesn't mean it's gonna happen for you. There's a greater chance that you are going to make the issue worse. So just don't listen to them. Okay, so let's talk about it. What is it? So everybody has abs, even if you're like, no, I don't. I had a baby and I'm like, I don't look like I did pre-pregnancy. Everybody has abs, whether you can see them or not. So if you imagine that like typical like six pack, it is the separation of the midline. So there, like, let's not even use that word. It's an increased distance between the left and the right side of what's called the rectus abdominis. And so yeah, it's along the vertical side of the abs, and that happens because of, in our case, in the purposes of this conversation, pregnancy, especially if you felt like your bump like showed up overnight out of nowhere. It's like it came so fast that can happen, and it's no reflection on you or how good your abs were pre-pregnancy or anything like that. It can just happen. So don't think like it's your fault or something, or you could have done something differently. Even if you could have, like, what's the point on dwelling in it? Let's move forward, you know? Like, just like with all the bounce back culture, what's the point of dwelling on that? Let's just move forward. So even I just called it a separation. Often it is often called a separation, even by like medical definitions, if you were to look it up. But I feel like that it can contribute to some of the misconceptions, because you think like, oh, there's like a hole now between my abs. But it oftentimes gets confused with a type of hernia that is called a ventral hernia. And the difference being is that with diastases, there's this layer called fascia, and there's no defect that occurs in your fascia when you have diastases. Whereas with the hernia, that's when like your guts basically like pop through, and that like wrecks the well, let's not say wrecks, but that damages the fascia. So that's a big difference. So basically, if you think of your abs, there's like a thin layer in between those like six packs, and that gets stretched when the distance increases, but it doesn't rip, basically, is what we are trying to visualize here. So what does that mean for you? So that can cause a bit of back pain. Maybe not even a bit, maybe a lot of back pain, because you're obviously you've had, your abs have been weakened, so you don't have the same core stability to manage your whole body. So that can cause back pain, especially because of the weight of the baby before it's born, and then the weight of the baby after, when you're holding it all the time. Like maybe you are baby wearing, all that sort of thing, and that contributes to possible back pain. I hope not, but it's common. And it can also lead to a greater chance of incontinence. And that's not a fun thing, especially since there's that statistic out there that 1 in 3 women experience leakage and incontinence issues. So this happens because the abdomen are working in conjunction with the pelvic floor, and when there's that weakened state from the diastases, then that affects the pelvic floor, unfortunately. And obviously, well, maybe not obviously, but it can create bulging in that midline area. And why does that happen? Well, oftentimes when we're trying to do core work, because we think like, oh, we want to look a certain way, like we did pre-pregnancy, but we don't know how to work with the diastasis that is perhaps present. Maybe you're doing things like crunches or sit-ups, and that in between your six-pack abs, that greater distance between the left and the right, and you're doing crunches, you are causing that area to what's called dome. And when you are doming with diastases, you can cause bulging at the midline, and that can be uncomfortable, of course. So it's definitely what you want to avoid doing. So yeah, that's basically what it is and what happens from it. So what the heck do we do if we have it? So in some instances, it's present, and you know it's present, but it doesn't bother you at all. And that's the best case scenario if you have diastases. Perhaps the distance that was created is not huge. I believe what the medical professionals say is if the space is 2 centimeters or greater, that's basically diastases. That is what is called the abnormal separation of the midline. But even if it's at that distance, it may not bother you, and that's a good thing because you don't want to be bothered. And obviously, if you do have diastases, the smaller that separation, the easier it is to fix. The greater the separation, the more complicated it becomes. So let's talk about the smaller end of that scale. So you have diastases, but you don't have a huge distance between the sides. It's just like, for the sake of this conversation, let's just say it's 2 centimeters. The first thing you can do to figure out how to heal and reconnect is to work on pelvic floor stuff. So that may or may not be surprising to you, especially since I was just talking about how the diastases can affect the pelvic floor. This happens because we don't know enough about the pelvic floor as a population. It's something every human has, and it's something that it's a big deal for women. And there's not enough, nobody talks about it, nobody educates you on that, and so you don't know how to deal with it. Sometimes, sadly, the greatest information you've been given about the pelvic floor is from sitcoms. Like, I remember watching Arrested Development when it first was airing. So I guess I might have been in like late elementary school or high school. And there was like a scene where Lindsay Bluth was like just sitting in a like comfy, couchy sort of chair in exercise clothes. And they were like, "Oh, what are you doing?" And she's like, "Oh, I'm exercising." And they were all like, "What?" And on the TV, it was like a Kegel class. And she was like making a face every time she was doing her Kegels. And I've seen a bunch of shows where there's a scene similar to that. And sadly, like I feel like that's like the extent to pelvic floor education that the general population has, which is so sad because it is so much more complicated than that. So yeah, people think like, oh, I'll just squeeze and release and I'll be good. Like if I'm having a baby, I'll be good. That will just squeezing and releasing is going to make sure that I don't have any pelvic floor dysfunction. But then again, there's that stat that's 1 in 3 women experience leakage and incontinence. And it's no wonder since there's barely any education on the pelvic floor. So when you learn how to work with the pelvic floor to, up that function and make sure that everything is working well, that will, by necessity, also help with your abs. The reason for that is that one of the best ways to work on your pelvic floor function is through pelvic tilts. And when you are working on your pelvic tilts in the correct and most optimal way, that engages your core in a very healthy way. So like I said before, you might be doing core work, you might be doing sit-ups and crunches. That's like the very traditional method of strengthening your core. But that doesn't do anything for your pelvic floor if you are not connecting, your mind to that area. And therefore you are bulging at that midline. So if instead you are working on your pelvic tilts, for example, in your cat-cow pose, then you will be engaging your core and strengthening your core in the most optimal way, especially postpartum, especially with pelvic floor dysfunction, especially with diastasis. There's no bulging that's going to happen because you're not doing that same action as like a crunch. You're making the movement happen from your pelvis instead of like thinking like, oh, I gotta move from my abs to make them strong. So that's the number one thing you want to work on when you have light diastasis, we will say. And even if you don't, postpartum, that's like probably the number one thing you want to work on. You want to really hone those pelvic tilts so that you can find your full range of motion for your pelvic floor. And then that leads into the next thing you can do. So I say working on the pelvic floor function and pelvic floor like strengthening and full range of motion as your first step, because you want to create that mind-body connection to your pelvis basically, and understanding, creating that muscle memory of how to engage your core in an optimal way instead of like a crunch or a sit-up way. If you have diastasis, even light, just stay away from crunches and sit-ups. Even if they're your absolute favorite core exercises, stay away from them at least for now until you are healed, because you don't want to make the situation worse. You don't want the doming, you don't want the bulging, you don't want to, make further complications that you don't need right now as a new mom. So when you figure out and you really create a strong mind-body connection with those pelvic tilts, then you're going to work on light core exercises that are not crunches, they're not sit-ups, you know, none of those like type of movements. Because once again, you don't want the doming to happen, and the greatest chance you're going to get of doming is in crunches and sit-ups, unfortunately. So once you understand the pelvic tilts, and even bonus, understanding the breath that goes along with it, because that is connected into the whole area. I will just quickly go into that. So if you think of your diaphragm affects your pelvic floor, believe it or not. And it can affect your diastases, believe it or not. So if you think of your cat-cow poses, this is the easiest way to visualize it. On your inhale, you are bringing your chest forward and you're tilting your pelvis so that your tailbone comes up towards the sky. Yeah, cow pose. I think I said cow pose. This cow pose we're talking about here. So you're inhaling, your chest is coming forward and your tailbone's coming up. As you inhale, your diaphragm goes down. So it's potentially on your inhales putting more pressure on your pelvic floor. So when your tilt is that way and your tailbone's towards the sky, you are blossoming open in your pelvic floor. Then in your cat pose, you are exhaling. Your chest is coming in, you're curling in towards your belly button, and your tailbone's coming down towards the floor. As you exhale, your diaphragm goes up, and coincidentally, your pelvic floor also goes up, and that is the strengthening because it is engaging, whether you are noticing it or not. That is what is happening. So when you can marry your breath with whatever core exercise you are doing, you can work on not doming and not bulging. So things that you could do would be like very easy planks. You could do, you could try out some things on your back, as long as it's not like a traditional crunch and sit up. You could do like bird dog. That would be a really good one if you know what that is. If not, you could look it up. It's from a tabletop position. Any of those ones that are like in the same plane as like a plank or a tabletop position would be really good for light core work. And when you're in those ones, you're gonna think of being in your cat pose. So you're thinking of your tailbone coming down towards the floor. And when you're doing the movement, unless it's plank because you're just holding it, but like bird dog, for example, when you're doing the movement, you're thinking of working with your breath. And that's going to help to retrain the muscles and to get them to come back together, like knit together, you know, hopefully over time. It's not going to happen in like 2 weeks, like those videos and shorts and reels that we talked about in the beginning of this video. It's going to happen over time. And the worst thing you can really do is try to rush these things, because, you know, it took 9 months for this thing to happen. It's not going to be healed in 2 weeks. And then let's talk about what happens if you don't have mild diastases, if you have a much greater distance between the sides, or if you are experiencing bulging, or if you are experiencing pain or discomfort. An option is surgery. So a lot of people will say if it's greater than a certain amount, and I'm not sure exactly the amount, some people will say like finger gaps, then they, they'll say there's nothing you can do except surgery. So I am not a medical professional. I can't speak to the validity of that, but I can speak to the fact that I can understand why some people would choose for surgery if the distance is great enough. So they do say if you are planning on having more children, not to go the surgery route, because it could probably cause a recurrence and put you through unnecessary hardship, basically. Like, who wants to go through a surgery just for it to all get undone, right? And they, if that's like, if you're like, no, I'm done, they do recommend surgery if you also have a hernia, because then they can fix it at the same time. Some people will also opt for like skin removal surgery, or maybe even like liposuction or whatever at the same time. Some people call it like a mommy makeover, and it's totally understandable if that gap is wide enough. And the only thing is, when you choose a surgery, they can do like open surgery or they can do laparoscopic. Obviously, if you want to do skin removal and like liposuction and all that, that has to be open surgery. So your recovery time is going to be way more than if it's laparoscopic. Laparoscopic is like, they do like tiny incisions and then they do their work. And the other thing to consider is if you need mesh or not. So if you've never heard of that, for like hernias, for example, they'll do like a mesh to like stick it back in, basically. They can do diastasis surgeries without the mesh. So that would be something to talk to your doctor about, because there have been many class action lawsuits against mesh in the past. And that's not to scare you. That's just something, to be aware of. Things are always improving and changing over time. So that would be just something to discuss if you are considering the surgery. And yeah, so if you get laparoscopic, I've had laparoscopic surgery for an ovarian cyst. It doesn't feel great after, like you feel like you've been cut open. But it's like, for me, I had 3 incisions that were like less than a centimeter. One was in my belly button, one was like maybe 4 inches underneath my belly button, and then one was like maybe 2 inches to the left of my belly button. And that was like, the first day, it was a day surgery. And that first day I felt like crap. I could move and stuff though. Like, I didn't need like a wheelchair or anything, but I was like moving slow, and I was like, don't touch me there, anybody. And like each day it felt a little bit better, and it was like very quick healing. And I just needed like some, basically they told me to take Advil and Tylenol, but if it was too bad, they gave me like a prescription for like super Advil, basically. But you can imagine if you do an open surgery, it's going to be way more than that. But yeah, it's definitely something to consider if you want to get all that other stuff done at the same time. So let's review. So diastasis is the greater distance between your left and your right side of your abs. And it's often confused with what's called a ventral hernia, and the difference is that your fascia is not affected other than being stretched out. Like there's no holes or rips in your fascia when you have diastases. And when you have diastases, it can lead to back pain, it can lead to incontinence, and it can lead to bulging, which we don't want any of those things. That's why we are here learning how to feel better. And the treatment is if you're on the smaller scale of your diastases, you're going to work on your pelvic floor function first and foremost to create that mind-body connection and get really good with your pelvic tilts, like become expert level at that. Like it is like second nature. You don't even have to think about it. Like that good at your pelvic floor, your pelvic tilts. Then think of like your breath with your pelvic tilts and even try to like feel how that affects you. And then once you have that down, once you are a pro at that, you're going to work on light core exercises to retrain the muscles to come back together. And if it is on the larger scale and you are done having babies and you are in pain and it's bothering you, then you can consider surgery. And the two types would be laparoscopic or open surgery, and you can consider mesh or not, something to talk to your healthcare provider and your healthcare team about. So I hope all of that was very informative. I hope that made sense to you guys. And if you have any questions at all, please do not hesitate to comment. You can message me if you have a question. Most people also have a question, so don't feel shy, don't feel dumb. You are not any of those things. And look out for my tutorial I'm going to be doing this week. I'm going to continue on with my hip pain relief series. It's going to be week 4. And look out for the poll on Monday to see what the live is going to be about. All right, I hope you have a wonderful rest of your evening or day wherever you are, and I will see you next time. Take care. Bye for now.